Thank you very much. It's really nice to hear about all the presentations and see all the great work that you've been doing. So I realized that the title of this talk is a little different from the one that was in the program, but I hope what I would like to try to do is to try to get us to think a little bit about how we can use research to understand the impact of policies. Instead of giving a sort of general talk about this topic, I thought it would be more useful to focus on a specific example and a specific project in which we've been doing this. So just to say that what I'm going to tell you today, it's really based on a paper that I've been doing with my co-author Li-Ming Li, who is at the King's College London, and that's been recently published. So let me start by motivating a little bit this paper. So in this paper, we were interested in the way that different policies that affect the family environment might impact children's socio-emotional development. And there are many policies that you can think of that might influence the ability of parents to care for their children that actually fall a little bit outside of the healthcare system. You can think of policies on work family, policies on early childhood education and childcare, social benefits to reduce poverty, housing policies, etc. And much of my work really focuses on understanding how these policies that fall outside of the health system actually can have a potential to influence children's health. One of the main determinants that has been very much studied in the literature relates to maternal employment, so mother's employment. And mother's employment has been one of the dimensions of family life, if you like, that have been the subject of major policy reforms over the last couple of decades. And obviously a change in maternal employment might be the result of a personal decision. So a mother might decide to work or to not work by their own decision, by their own kind of thousands of factors that make us make those decisions. But it might also be in some ways the result of policies that are in place and that influence the decisions that mothers make. And these decisions might have consequences for children's socio-emotional development. However, despite this, we have very little evidence of how these policies that have defined maternal employment decisions in some ways impact children's development. So just to tell you a little bit, so today I've chosen sort of to focus on this area of maternal employment and just to show you a little bit of trends about this. So maternal employment, as all of you probably know, has been increasing dramatically over the last couple of years. I'll move to this one. Here on the left, you see the age employment profiles for women, where you see that since the 1960s, let's say until the 2000s, we've seen increases also in the employment rate of young mothers, reaching around 70% across the OECD. So really the majority of mothers actually work today. On the right side, you see that this increase in mothers' employment has occurred quite rapidly since the 2000s until, let's say, around today, before the pandemic. And actually, that increase has happened also for mothers for women without children. So it's not specific to mothers. So it's probably driven by things that have been happening in general in employment rates. But we see this kind of tendency in OECD countries, as you all know, of trying to push women with or without children actually to be in the labor market. There are some variations across OECD countries in the employment rate of mothers. And then you see, for example, that in the United Kingdom, which is the country where I'm going to focus on, a significant part of employment is actually part-time employment, so around half of that. That's quite different, for example, in France, where it tends to be more full-time employment. And different, for example, from the United States, or different from the Netherlands, where a really large part of a majority of women, mothers who work, are actually in part-time employment. Now, I'm just showing you a little bit of trends for you to understand a little bit the context before we get into the actual policy that we're looking at. Here you see a comparison between partner mothers and single mothers across the OECD. And what you see is usually that single mothers tend to have slightly lower employment rates in many of the countries. Not in all countries, but in many of the countries. And it is the case in the UK. And also, as we saw in the previous slide, a lot of that employment is part-time. So partly as a reaction of this fact that lone mothers have employment rates that are lower than employment for the general population, there's been this kind of tendency in many countries to try to develop policies that might incentivize the employment of mothers. Now, in the UK, it is believed that the largest increase in maternal employment really occurred in lone mothers that went from around 44% in the end of the 20th century to 65% today. Let me see this, I think we've already discussed. A lot of this increase has been believed or attributed to some policy changes, such as the change in the work tax credit or the availability of childcare. But in more recent years, a lot of this increase has been at least theoretically attributed to welfare to work programs, which is the policy that we're going to focus on today. These are programs that focuses or targets often lone mothers by conditioning the receipt of benefits on some kind of work requirement, usually the requirement to search for work. And so I want to, so this probably sounds like really far away. And usually when we think about policies, we're thinking about something that really happens at the legislative end. But these legislations have actually obviously implications that go all the way down to the family and the children. And that's kind of the example that I want to illustrate today. This paper really focused on the lone parent obligation policy, which was a policy that changed something which was called the income support for lone mothers in the UK. And essentially before November 2008, all mothers with children below 16 years were eligible to this income support regardless of anything else. So they were just eligible for this income support. But after November 2008, the government introduced these requirements for certain mothers that they will need to actually search for work in order to continue to be eligible to this program. Now, the other change that happened over time since 2009 is that the eligibility for this income support benefit was gradually reduced. So before it was up to the age of up to the moment in which your children were 16, you could receive this benefit, but then it was gradually changed to 10 in 2009, then to 7, then to 5, and then to 3. So this is kind of part of the kind of welfare benefit retrenchment system, let's say in the UK, in which the governments basically try to reduce the amount of benefits. Let's say with a good intention. No? It's not that they are trying to be méchant necessarily. They are trying to probably save the budget on the one hand, but also to increase women's employment. And then so the implication is that many mothers had to search work and actually take up work that they found. Now, is it a good idea to have a policy that incentivizes lone mothers to work? Now, you might think there may be some positive effects. On the one hand, a welfare to work policy may increase labor income if women are actually responding to it and working more. And then in the end, it might reduce poverty, which we know is one of the main predictors of socio-emotional developmental problems and violence as well. You may also think that with more resources, then basically families are more in a position to invest in their children. They may also lead to an increased sense of control by mothers, and this may lead to a better mental well-being for the parent, for the mother, which might be actually to lead to also to benefits for a child. It might improve the quality of parenting, and it may connect these families that maybe sometimes a little bit detached from the context. And this may turn out to be beneficial for socioeconomic development. So it's not immediately obvious that a policy that incentivizes a lone mother's employment will have a negative effect on the child. On the other hand, there may be some negative effects. For example, we know that these programs will reduce benefit income, right? Might not reduce total income, but it will reduce benefit income. It might also, because of this, influence mental well-being of the mother. It will increase what we call the opportunity cost of time. So for mothers, it will become more expensive to spend time raising their children, right? So there will be this competition between time for work and time spent with the child. Many of the increase in employment caused by these policies is in low-paid employment and in flexible jobs, which may lead to stress and all sort of changes in the way mothers engage with children. And lone mothers might be particularly vulnerable to all of these things. So they may have some difficulties to maintain employment, lack support, and etc. So what did we want to do in this particular paper? In this paper, we wanted to kind of test the hypothesis, or essentially try to evaluate the causal impact of this LPO, loan parent obligation reform, on the socio-emotional development of children and adolescents. And we thought that focusing on children's outcomes was obviously relevant because this is a policy that has nothing to do in a way with children's socio-emotional development, but any little implication that it may have might impact children's future outcomes, cognitive and not cognitive skills, human capital formation, labor market outcomes when they become older. So what we did in this paper, which is really what you do when you try to evaluate the causal impact of a policy on families and children, is we went to try to find data sets that actually follow children during, before, and after the introduction of the policy. So we use data that must be known to many of you, the UK Millennium Cohort Study, which is a study that follows children that were born around the turn of the 21st century, since 2001, and followed them every 2 years approximately until today. We use data from the Child Strengths and Difficulties questionnaire and look at the total scores and subscores of children at different ages. And essentially, I'm going to tell you that in a moment, but we had a sample of lone mothers in this cohort, which we compared to a sample of partner mothers. I'll tell you why in a moment. And then we include a series of controls. We define maternal employment as whether the mother was in paid work, and also the number of weekly hours that she was working. I'll go to this one. One of the challenges to establish the impact of a policy is that we cannot just compare say, a group of women who are eligible or not eligible for the policy, because these two groups are going to be very different. So we use that technique that is often used in econometrics, which is a difference in difference approach, in which we try to identify a treatment group. In this case, it's quite obvious, is women who so lone mother families are our control group, and normally you would like to know whether before the reform and after the reform, whether mental health outcomes for the child actually change before and after the reform. But any change between before and after the policy could be driven by the policy or by 100 other things that may have happened. So we always need a control group. And this control group sort of serves as a kind of counterfactual of what we think would have happened in the absence of the policy. So that difference between that counterfactual and what we observe in the lone mother families would be kind of the causal effect of the policy. Now, the challenge is always on finding a control group that actually works, that we think would have had similar trends over time. So in this case, we focus on partner mother families who have obviously different levels. Their children have different levels of SEQ score, for example, but whose trends actually were very similar over time to lone mothers. So essentially what we do, we look at the impact of this policy on children's outcomes by looking at what happened before and after the policy, comparing the control group, partner mother families, children, and children from the treatment group, lone mother families. So what I'm going to show you is the results of comparing these two families. Okay, so maybe a little bit on the results. These are trends in maternal employment. Maybe the first thing to look at is how this policy affected the decision of mothers, lone mothers to work. So these are trends in maternal employment rates for mothers of children in the MCS study. And what you see here is that, first of all, lone mothers, as we know, have a lower employment rate than partner families, partnered mothers in a partner family, if we say like this. But what is interesting is that if you see this as kind of the point before and after the policy, is that there was an increase in employment rates for lone mothers after the policy, which was about 10 percentage points, which is a very, very large increase. While among partner mothers, we see very little change and maybe later a decline in employment rates. Okay, so it seems like the policy, if we believe this control group at least, seem to have actually increased the supply of labor by lone mothers. Just to put this in a different way, this graph shows you the comparison between before and after the policy for, let's say, the control group and the treatment group. First for 2015, the first year we had after the policy. And what you see again is, bigger increases in employment for lone mothers than for partner mothers, and then a similar pattern, let's say for 2008, an increase in employment for lone mothers and actually a decrease for partner mothers. This is, I guess, the main result of the paper, kind of summarized in a graph. Here we're trying to compare what happened to the SDQ scores, our measure of socio-emotional development of children and adolescents in this sample. And what you see here is that between before and after the reform, there was, let's say, very little change in SDQ scores for the control group, for the partners' families, but there was an increase for children in lone mother families, taking 2015 as the post-treatment year. If we take 2018 as the post-treatment year, we see actually a decline in partner families, but no such decline was observed for lone mother families. Now, this may be a little bit difficult to interpret as such, but what it's telling us is that the changes were much more positive, let's say, for children in partner families as opposed to lone mother families. Now, we put all of this together into some kind of model in which we control for everything that we can, and we look at whether these changes between before and after the policy are truly different between treatment and control. And then first for employment, we see that indeed there was an increase of about 10% of employment rate for lone mothers and an increase of around 32% in working hours for mothers. So mothers did actually increase their labor supply. And this is kind of the main results, looking at the impact on emotional symptoms, peer problems, hyperactivity, and conduct problems. And what it shows us first is that lone mothers who became ineligible to claim these income support benefits experienced a significant, maybe small, but significant increase of about 0.16 of a standard deviation in emotional symptoms, an increase in peer problems, and also an increase in hyperactivity. We didn't find an increase in or a significant change in conduct problems. So what this suggests overall is that it's not a huge change. It's a relatively small change, but we do observe actually an increase in SDQ scores, suggesting a small negative effect on the socio-emotional development of the children. Now, we tried to see what had changed within the family environment as a result of this policy that may have explained this increase in socio-emotional development problems on an SDQ scores. And this table shows you a little bit of a summary of the things that changed. So anything that have stars signifies kind of a significant effect. So the first interesting thing that we see is that the policy didn't actually lead to a decline in family income. Actually, we see a slight increase in family income of around 8%. So the policy didn't actually make these families, on average, maybe some families did become poorer, but it didn't make the families necessarily poorer. So it doesn't seem to be driven by an income effect. Now, there was a decline, a small decline of around 2 percentage points in the probability of living in social housing. But there was not a clear, at least we didn't observe a clear decline or increase in the risk of poverty. So the policy didn't actually reduce the risk of poverty, which is one of the objectives of the policy, but it also didn't increase it. Now, what I think is quite interesting is that it had quite some negative impacts on the well-being of the mothers. So this policy led to an increase in the report to mothers, for example, reporting poor self-rated health of about 4 percentage points, but also an increase in psychological distress. So mothers seem to be, so they increased their labor supply, they had a little bit more income, but they were also much more, not much more, but they were in poorer health and they reported more psychological distress. And there was this item that's in the MCS, which tries to evaluate to what extent parents are satisfied with the amount of time they spend with their children. And I'm sure we all parents feel very guilty all the time about this. But what we see with this study is that they actually find an increase of about 5 percentage points of the probability of reporting that you think that the time that you spend with your children is insufficient. Maybe that's not surprising and not necessarily a bad thing, but maybe together with this other kind of maternal outcomes do suggest that this policy may have led to some negative effects on the children's SDQ scores as a result of changes that happen in the mother. Okay, so just to tell you, there's a lot of kind of analysis that we do in this paper, but in general, we don't find kind of a clear story around heterogeneity. This seems to be happening across the board for boys and girls, different ages, different types of work, etc. And I won't go into the details, but we look at this in different ways, and we seem to replicate these results in different ways of doing it. So maybe I'll kind of stop here, but I think what this study really shows us is that a reform that changed the labor supply of single mothers by requiring them to search for work as a condition to receive benefits led to a small but significant increase in socio-emotional problems among children. The reform did actually increase employment and led to higher income overall for the family, despite the fact that some of them may not be any more eligible for the benefit. But it didn't reduce poverty, and it had this negative impact on mothers' psychological distress, and also, at least on their reporting of satisfaction with the amount of time that they spent with their children. So I choose this policy because I think it's a nice illustration of a policy really far away in some ways from children. This is not really motivated by an interest in children. So here, like in the previous presentation, we saw the interest of the child is the first. Here, it was not the case. This was a policy, obviously, maybe with a good intention to address the policy goal of reduce government expenditure or increase maternal employment, but it has consequences for the family environment, which ultimately impact the well-being of the children, which are often overlooked. So the reason why we do this is a little bit to tell policymakers, you need to think about how different policies in different dimensions actually have an impact on health, and you need to incorporate this kind of analysis in the cost-benefit analysis that you do for each of the policies. So actually, in the place where I work, in Lausanne Center for Health Economics, Policy and Behavior, what we do is to look at the impact of many different policies on early childhood education, labor market, poverty reduction, and housing policies, and how they impact outcomes. Okay, thank you very much.
Thank you, Mauricio. Questions? Yeah.
So you can speak louder if you want.
No, it's for the machinery.
Thank you. Thank you. That was a great presentation. So maybe a very naive question, but did you share those findings with the government in the UK? What was their reaction?
Yeah, good question. We do have, so before going to Lausanne, I was based in London, and then when we published the paper, I had already left. So that's my excuse. But we do work a lot with the Department of Work and Pensions. I was telling you also that we did a new study, for example, about the impact of the pension reform that I can tell you about. And they do actually listen. So these departments of work and pensions, they do have a group of people who actually are more kind of policy analysts. And then, they listen to your results, and they actually take this up to so for example, they decided at some point with this retirement policy to improve the way they inform women that they're going to retire, not at the age of 60, but at the age of 66, things like that. So, but I don't have the feeling that they think that these justify a structural change in the policy. But they may do little things to try to change the way the policies are implemented and things like that. But yeah, I guess we could do better at having more contact with higher level politicians. Yeah.
Yeah, Maria.
Thank you for a great presentation. I was wondering whether there's any way you could actually look at some local effects. Is it, or is it just that? I think you've explained it really well. That yes, the types of jobs that women will access are probably. Well, if they don't increase their income, they're probably really low wage and really unqualified. But would that vary depending on where you live or the labor market in the area where you live? Is there any way in which at least this type of policy could be adapted locally to provide, to at least, if not benefit, at least impact the least the mother's mental health and the children?
Yeah, no, that's a great question. I mean, you could even think of defining what you require as employment, for example, as employment that is compatible with taking care of your children, for example, or something like that, by making some kind of judgment about how to assess that. in practice, you could do that exercise and look at women in different employments. And what's difficult with in looking at the impact of these policies is that in the end, what you observe is the women's decision to take this or that job. And that decision is not only the result of the policy, but also the result of your skills and many other things. So it's not so easy to let's say, not so easy to take that into account in the analysis. Now, we didn't find sort of effects that were different for different occupations, for different educational levels, which suggests, that maybe it doesn't matter too much which occupation you do, but it may also be that you need a lot of statistical power to actually identify these effects. So when you look at the heterogeneous effects, you're not very well powered. So that's the limitation. But yeah, I agree. You could think of ways in which the policies might be adapted to identify jobs that might be more perhaps harmful than others. Yeah.
In the UK, we have probably the most expensive early childcare services in the world, as far as I can gather, certainly before the child's the age of 3. How might that have influenced some of your? I saw you had that as one of the areas, childcare, early childcare, but that's as far as I understand it, at least, for many parents in Britain. That's a huge problem as to how to get care for the children while they're working, especially for lone parents.
Absolutely. You're referring costly, you mean in terms of private costs? Costs for the families. Yeah, absolutely. Yes. We actually, a lot of the studies that have been done on maternal employment are focused on that age range. This study actually captured MCS children when they already were at school. So all of these children would already be at the school age, so that wouldn't sort of directly impact these results, unless they had another child who was younger, but very few mothers did. But yeah, it's a good point, and certainly that's a policy that's interesting to look at, also because there have been some reforms changing the age eligibility for some of the benefits. Yeah. Also, these benefits, as you say, are not very generous. Yeah.
No. Yeah.
I have a little bit of a provocative question.
Yeah. Okay. Can you do it through the microphone?
And I maybe know the answer. Are there no lone fathers?
In the sample.
And are they hit by the same reform?
Yeah.
And
good question,
the reason why I ask is that we tend to sometimes forget that children have fathers. It is one thing. And another thing is that in Denmark they are doing a reform like that, but pointed against immigrant women, which I think is close to being both sexist and racist.
Yeah, thank you.
Could I add one comment to that? And which is that I didn't see that you had paternal involvement as a covariate. And I think that you could actually see different effects depending on whether the child has a father who is really involved or not. Because when the stress increases in this situation, if you have the father may become even more important.
Yeah, no, great points. Maybe to the first question, there are a few single fathers in the MCS data set, which will not be enough to look at this in that group. I think it's 97% of all single parent households in the MCS are single mothers. So definitely great idea, and personally very interested in this population, but we couldn't look at that. And then I forgot the other question. The paternal. Yeah. Great suggestions. We didn't look at it in detail. The interviews in the MCS are with the primary caregiver. So there isn't a lot of information, but there's some information about that. So we definitely could look at that. Yeah. Thanks for the suggestion. Yeah.
But my question was, how was the reform? Was it in the reform mentioned that it was only for women?
No, it's a lone parent obligation, so it's a parent. Yeah, sorry, I should have explained that. But most lone parents, or the majority of them in the MCS data, but also in the population in general, are lone mothers. This is true, for example, so in New York, for example, where we did an experiment as well. It turns out just in the data that you find that almost all of them are single mothers. Yeah.
So I guess I want to be convinced that it is reasonable to use partnered parents as your control, because this is an aging cohort, right? And I would imagine that as these children age, the experience of being a parent changes, the experience of being a partnered or a lone parent changes. There's a lot about that decision around taking employment. I speak as a lone parent myself. The decisions that you make change, and the partnering or not partnering, I'm not entirely convinced that control totally works in this example. So that's a question. And then there's also a comment for our non-UK colleagues, and perhaps for our colleagues too, is about really the other context for this is that this is not a kindly policy. This is utterly a punitive policy, and about a pattern of punitive policies. Another one of which is our 2-child limit. And for those who, just yesterday, Mary Reeder and Kitty Stewart and others published a new, so there's another tranche of policies about punishing families with more than 2 children in them. And they published an analysis yesterday that shows that absolutely doesn't increase employment around for families. And the bedroom tax. And so these, they come with a veneer that this might be about increasing employment or whatever, but that is not what they're about, and they generally don't. So,
thank you. Maybe just sort of the first question, which is really a very good question and very legitimate, and we spent a lot of time trying to convince ourselves and convince the readers that partner families are a good control group. You're right. We can't be sure that they are a good control group. Just to say that you could have taken a group of lone parents who, for some reason, are not eligible for the policy. We did something like that. It's not as clean as what we do here, but it kind of gives more or less the same results. What you want is a group that is not exactly the same as the treatment group, let's say. What you want is a group that would have had similar trends over time. And for that assumption, we didn't find evidence that it was kind of that it wasn't met, let's say. But you're right. So because these children are the same age, what we're assuming is some kind of similar pattern of SDQ scores over time that are similar to the two. To my surprise, those trajectories for both children in partner and single families were very similar. But you're right. There may be, this is the challenge of these policy evaluations. You're never sure whether your control group really captures that well.
Yeah, David, quickly. Oh, sorry,
maybe just last point. It's interesting what you say, that it doesn't increase employment. Just a small comment on that. I do think that some of these policies do actually achieve the goals that they aim to achieve. So, for example, retirement, age of retirement increase, that's actually quite effective to increase the supply of labor among women. Now, my critique is not that they don't work for what they aim to do, but that they do not consider the, unintended consequences of those policies for the well-being of women or for their children. So I think there are policies that, you're right, don't work, but there are policies that do work for increasing employment, but, they have costs as well for families and children. Yeah. David, thanks.
Yeah, thanks very much. It's really important studies. And I guess a feature of welfare reform in the UK has been increasing sanctions and benefit conditionality. And how do we package all this evidence for our government? I mean, it does seem that a number of studies have shown that negative impacts on parental health as a result of especially conditionality, and that's impacting children's mental health, which must have huge societal costs in the long run. And we're grappling to understand what's driving the big rise in mental health problems in the UK. I wonder, any messages for government, and any feel for how much of to what extent could welfare reform in the UK be driving the adverse trends in kids' mental health?
Yeah, very good question. So maybe two things about that. The first one is, I think it's a very difficult trend to stop, to stop this trend towards more kind of economic independence of families. So maybe the way to think about it is what can be, like Maria was saying, what can be adapted in these policies so that some of these effects are integrated into the policy. So that's maybe one thing that, to think about. And maybe the second point, having memory problems today. I forgot the second question again. Yeah, so your question was about how do we present this to policymakers and whether it's the explanation for increasing mental health problems. It's tempting to say that, I think. Personally, I don't think that is the main cause why we see increases in mental health problems among children. But certainly, these policies affect a particular group of the population, and for that group of the population, maybe one of the many elements that increase mental health. To my surprise, policies are sometimes only part of the story. When I started to do this, I thought policies explained everything, social policies, but actually policies are only changing behaviors in ways that are not necessarily as strong as other things that happens in people's lives, which have much stronger effects. But yeah, this may be for debate. Yeah, thanks.
Okay, thank you very much indeed, Mauricio. That's very challenging.